Jonathan, ozone can be used in a lot of different ways. Can you describe for us what is major autohemotherapy?
Yeah, so you're right, and that's one of the reasons people really love it. Major autohemotherapy is considered a systemic way to treat a patient. So we have local, some that are a little bit more localized as far as administration methods, and some that are considered systemic, treating really the whole body, and activating the antioxidant defense system is really one of the key things in ozone therapy and in really allowing the body to utilize oxygen more efficiently. This is a key factor in that. And so with major autohemotherapy, what we're doing is we're actually infusing blood with ozone. So to do that, we have to withdraw a small amount of blood from the patient. We usually, with animals, around 2 cc's per 10 pounds that we're going to withdraw. We're going to infuse ozone into that blood. Now, all of the ozone is absorbed immediately into the blood. So you don't have to worry. You're going to have a syringe that, let's say we have 10 cc's of ozone oxygen mixture in there. When we infuse that into the blood, into another syringe, there's going to be some oxygen left in that syringe along with the blood, but all of the ozone has been absorbed and turned into ozonides and peroxides in the blood. So just don't be fooled by that. We've got all the ozone into the blood. And once we have the ozone in the blood, we're going to go ahead and reintroduce that into the vein in our patient. And this is the treatment method that's been used for a long time. And in human medicine, it's the most common way to administer ozone to a patient. Okay. In veterinary medicine, we're catching up, we're getting there. It's a fantastic way to treat the patient.
So tell me, what are some of the benefits of putting ozone intravenously into the bloodstream of an animal?
Yeah, so the thing that I mentioned right off the bat, with activating the antioxidant system is really key, because what we're doing is when a patient is sick, chronically ill, or even as we age, our bodies, the mitochondria are breaking down. There's poor production of ATP, which is essential for the cell to be healthy and to have all the energy it needs to do what it does. And when those things are suffering, we can't live a healthy life. And so what ozone does is it's going in and it's correcting on a cellular level the cell's ability to utilize oxygen that is already available to it. So we're not just flooding the body with oxygen, although that's happening. We're also correcting, really on a cellular level, an imbalance to be able to allow the body to function more efficiently.
Let me see if I can say that again, because
Yeah.
that was beautifully put. Our health truly depends on the ability of our cell to produce energy. And when that ability to produce energy gets compromised, whether it's through toxins in the environment or stressors or aging and free radical production, that causes the cell to not be able to utilize oxygen or to make enough energy. And what you're saying is introducing ozone helps to increase cellular metabolism so the cell can go back to making oxygen, making the ATP, or actually utilizing oxygen, making the ATP so that it can actually utilize and produce energy, and also reduce free radicals, basically creating an antioxidant state in the body.
Yeah.
But the body's natural antioxidants are stimulated to be produced.
Exactly. And that's the thing.
We got it.
Yeah.
Perfect.
Yeah.
So for our veterinarians, talk a little bit about dosing. How do they know how much ozone to draw up and how much to give per patient?
Yeah, so with major autohemotherapy, what we do, we recommend at least a baseline of 2 cc's per 10 pounds of blood to be drawn, 10 pounds of body weight for the patient. 2 cc's of blood to be drawn. And you're going to infuse. Now, there are various, you go around the world and you talk to different veterinarians and doctors who do this, and you're going to find a variety of answers as far as what we should
protocols
be treating with as far as the protocol is concerned and the dose. We stay on the conservative edge because we have a lot more information scientifically about that.
So you're saying we stay on the lower edge of ozone therapy. I know there's people out there that are starting to do high dose
Real high
ozone.
doses.
Yeah, real high doses. and there's a lot of controversy over that.
There is
So
controversy.
we're going to stay in the part that's been tested and we know how it works. We're going to stay in the low dose side.
Yeah. For now, until it's proven. That's how we look at it. And we just want to do no harm first.
And I've been using the low dose side, and it's been extremely effective.
Absolutely, and that's why we're happy with it.
Yeah.
it's been proven to be effective and safe.
Excellent.
So we start with that baseline of about 2 cc per 10 pounds. We're going to infuse about the same amount, a 1-to-1 ratio of blood to ozone. So if we have 2 cc's of blood, we're going to do 2 cc's of ozone. And we have a particular concentration range that is appropriate. Anywhere from 40 to 60 micrograms per milliliter of ozone would be appropriate in this setting to do major autoimmunotherapy.
Excellent. So the mechanics of that, we've made a video so they can see that.
Yeah.
But what we want to make sure that they understand is how much blood that they're going to draw, how much ozone they're going to put in, and the concentration of that ozone that they're going to infuse.
Yep.
So it's 2 mils per pound of body weight, an equal portion of ozone, and the ozone concentration is going to be between 40 and 60 micrograms per milliliter that is mixed together.
That's correct. And we would feel comfortable. Some veterinarians and some doctors want to do a little bit more, and you're still not going to be doing high dose even if you were to double. If you were to put 4 cc's of ozone into that 2 cc's of blood, that wouldn't be considered high dose ozone yet. But we're comfortable with that. And so we want to leave a little bit of variance for the veterinarian to decide, what are you seeing? Is this a patient we always say start low and go slow. Is this a patient who's really compromised, older, struggling with a lot of health issues? Or is it relatively a younger, healthier patient that can probably,
withstand a
little bit higher dose of that oxidative stress on their body and still do well?
So the concept there is that it takes energy to heal. So if an animal already has a compromised energy system, you don't want to blast them with a high dose of, I'm going to suck a lot more energy out of you. You want to start a little lower and allow them to adapt.
Yep.
Great.
Yep. And that's just wisdom, common wisdom as a veterinarian. And you need to know you know your patients, you know your practice. So as you get comfortable with ozone therapy, feel it out a little bit.
I'm going to share an analogy that I was taught a long time ago. When you're starting a fire and you're just starting that fire and you have your little twigs and your little kindling and you get a little tiny blaze going, you're not going to drop a log on that because it'll smother it out.
Exactly.
And so when you're dealing with an animal that has a lot of health challenges and is already compromised, they're like their energy, their chi is like that little kindling that's just barely flaming there, and you don't want to squish it out by putting a big log on it. So you want to build it up a little bit until it's a big roaring fire, and then you can drop your logs on it. Make sense?
Yeah, that's great. Yeah.
Okay. That's one cut. We're going to keep.
Okay, in the future, when you start to end, just stop just for 2 or 3 seconds before you do that, because that's going to take a major bit of editing to eliminate that last comment.
Okay, so we'll just
when you stop, and
give
then
it 2
make a comment.
Give it 2 seconds. Okay. Okay. What's our next one?
Okay, so minor.
Okay.
Let me grab the sheets and just set them here and we'll drop them
While
down.
we're doing this, I'd like to add a little more light.
Yeah, sure. Okay.
Was that enough, or do?
Oh yeah, it looks fine.
Okay.
I'm particular.
Okay. Good. How'd you feel about that?
Good.
It was real good.
You?
Yeah, real good. I think that conversational way is that you brought it one way, I re-edified it a different way, and so people have 2 different choices on how they understand it. So that was good.
Yeah. Yeah, and I think the only thing I think we missed a little bit is talking about the indications.
Well, we'll do it right now. Well, we're doing the therapies. We can go back and say why the indications for major autoimmune therapy, particularly.
Yeah, I'm just thinking,
Okay.
so and maybe it's not something we need to do, but we might as well have it in there. Talk a little bit about. Okay, why would you use this as opposed to another administration method?
Okay.
To treat.
How about let's talk about minor autohemotherapy, and then I'll ask you to contrast.
Yeah, that's fine.
Okay. Ready?
Yeah, whenever he's good.
Now, may I assume that this is not going to be added on to the prior? This is a separate segment?
This is separate.
segment.
I made that assumption. I just wanted to verify.
Yeah.
Because because I'm changing a
Each-
little.
Each one that we
Let
do,
me finish my sentence. Okay. I'm changing when I sense that I'm changing configuration a little bit, so the audience does. Oh, it's the same thing, same talk. When they see, in this case, you're going to, believe it or not, you're configured very differently this time in this segment than you were before.
okay,
And I've changed the level and all.
Okay.
I'm just
Okay.
verifying that this is in fact a
Yeah.
separate section. Now, what were you going to say?
each one of these therapies,
Uh-huh.
they're going to be a separate segment.
Oh, okay. I'll
Yep.
make adjustments each time to
Okay,
give a sense of, okay, this is not
I think
something
we have
different.
like 6 of them or
In
so.
fact, what we may do in a couple of them is just have you switch seats.
Oh, okay.
Okay, just a thought.
Okay. All right. Let me see.
You have a
Maybe
patient?
going to the groomer, so
Are we
she looks like
stopping?
she's going to the groomer.
No, I think we can go, right?
Yeah, we're good. Okay. Cut, cut. I like that. Chop, chop, chop. All right.
You're wasting tape.
All right.
So minor.
Another form of using ozone is minor autohemotherapy. Can you describe what minor autohemotherapy is?
Yeah, absolutely. So if you know a little bit about major autohemotherapy, minor autohemotherapy should ring a bell a little bit, you know. But we're using blood, and we're taking a real small amount of blood. So if we have an animal, let's say under 10 pounds or under, we're really probably going to be using half to 1 cc of blood. That's it. And what we do is we withdraw the blood again, and we're going to infuse it with ozone just like we would major autohemotherapy. We're not going to put it back intravenously though. We're going to actually inject this into the muscle. So the concept here is to produce an immune response. And so really we're going to take that blood and that ozone mixture, and we're going to shake that syringe up and really be rupturing the blood cells. The point again is to induce an immune response. And this can be used in a number of different things, you know, for allergies or as an adjuvant as well to cancer. Sometimes they'll be injecting it around a tumor or something of that nature as well, instead of right into the muscle. But that's more or less what it is and how it's used.
So I'm going to break down the components. Minor, meaning that you're using a smaller volume. Auto, meaning you're using the individual's own blood. And hemo means blood. And of course, we're doing a therapy. This is a concept that's actually used in homeopathy, where you use the body's innate information, which already has the cellular memory of what's wrong, and when you reintroduce it intramuscularly, it triggers the body's innate understanding to help self-heal itself.
Yeah, exactly. And I believe God created the body in such an amazing way to be able to do that.
Absolutely.
And you mentioned it's auto, you know, so look at this as almost like an auto vaccine in some senses.
It is.
That your body is doing what it needs to do. You're slapping it, you're waking it up, you're getting it going, you know, when it was maybe suppressed, maybe it wasn't functioning like it should be, but you're giving it that little kick to get it started.
Excellent. That was a wonderful explanation. I know, I saw her coming in. I wanted to, you need to preempt that.
That was almost enough time.
It was. I'm going to ask the dosing.
Yeah.
You mentioned a
Yeah, I
small
did.
dog 1 cc, but
Yeah.
I'm going to ask you if you have
specifically for
yeah,
yeah,
give me the
I will.
specifics of dosing and frequency.
Now,
Yeah.
is this a new section we're starting now, or in
This-
addition to
It'll
what-
be in addition to this last one.
Okay.
And the other thing I didn't ask you was the frequency on the major autohemotherapy. So we're going to have to splice. I'll finish this one so it's together, but then I'm going to ask him what is the frequency of being able to use autohemotherapy, and it's 1 to 2 times a week.
Yeah.
Okay.
Now, that, what you just said is a continuation of what we're going to do next?
The first one.
Oh,
And I'll say it, I'll do it, I'll let you know this is going to be tagged to major autohemotherapy.
okay. One of the things that you can do to help yourself in identifying these is to say precisely that when that section begins, okay?
Okay.
Because I won't know where to put it
Sure.
necessarily, but you all will.
Yeah.
Sure.
Okay. So we probably should make a little note to make sure that we talk about what it is, dosing and frequency, benefits. Make sure we have that in each section.
Yeah.
Okay, I'd like to stop and start again. We're approaching the gigabyte limit, and that way there'll be one less challenge here.
Okay.